We're covering the vertebrae, and we'll start by comparing the differences between cervical, thoracic, and lumbar, just so we can tell the differences between them, because in most exams or tests, they ask them separately. So let's look at this as we describe the three. We put them together, we can tell by size. This is a cervical vertebrae, this is a thoracic vertebrae, and this is a lumbar vertebrae. Now, just doing process elimination, the best way I can determine that I have a cervical is when I look inside, there's actually 3 holes that make up a cervical vertebrae. And what's unique to them are these holes that are in my transverse process, and these are called transverse foramina. Transverse foramina. These are unique to cervical vertebrae that I don't see in my thoracic or my lumbar. So just by process elimination, I could already determine is it cervical or not. And some of the cervical vertebrae, not all of them, but on their spinous process, you can see these 2 little projections. That's called a bifid spinous process, that there's 2 heads coming off of it. Versus when I look at the other 2 types, thoracic and lumbar, they don't have those spinous processes that project 2 different pieces. So I can already rule out a cervical once I look at those 2 holes, again, which are transverse foramina. When I compare thoracic versus lumbar, the easiest way for me is when I look at the hole in the center, which is called the vertebral foramen. Remember, foramens are holes. So that hole in the middle on the left, this one's a thoracic, and it's a nice circle. When I look at a lumbar, it's a triangle. So I can compare the 2 just by that hole. The other thing I just look at is the design of it. When I look at the centrum or the body, it appears to have a heart shape for the body. Versus cervical and lumbar, I don't see that same heart shape. The other thing I just look at is just a general description of it. A lot of my students will say a thoracic looks like a giraffe or an elephant, as if this was the elephant's trunk, which is the spinous process, versus a lumbar tends to look like a moose. So I just go by these blunt processes and the appearance of it, that a lumbar tends to look like a moose. Now, as I get into the different structures, one thing to notice when we identify our processes, that the spinous process is our further posterior structure, bony landmark, that this spinous process is always going to point down. This spinous process is always going to point down. And so when we look at our spinous processes, these are the further posterior bony landmarks of each vertebrae. When I look at the sides, as if it's like the wings, these are transverse processes. So transverse processes. Transverse process, transverse process. Transverse process, and a transverse process. When I look at a cervical, I know I have a transverse process, and that's because it has holes inside. Remember, those are called transverse foramina, which are unique to a cervical vertebrae. Now, when I looked to how we create the actual vertebral arch and the circle around it, so as I go around and create this, all these bony landmarks, what we're describing first is all of them have this, but as I look at the centrum or the body, I describe these as like bridges. So in order to get from the body or centrum to the transverse process, I go through just this little bridge called a pedicle. And this is very small and difficult for students at first, but I just imagine as if I'm to drive from here to here, my body to my transverse process, I drive along this pedicle. In order to get from transverse process to what I'm holding is the spinous process, this bridge is called the lamina or laminae. So as I go from body to transverse process, I have this little connection called a pedicle. In order to get from transverse process to spinous process, I go through the laminae. So I'm describing those bridges. Now, how do I connect the vertebrae? What we use are called articular facets. And what I'm showing here is I'm going to take a couple thoracic and put them together. And where they're connecting are on these flat sections of the bone. And so where I'm sliding, these are called articular facets. And so when I look at it, to me, I describe it as if I'm holding my hand up with my arm. The flat, smooth side of this is called the superior articular facets. So it's like the ears of the elephant. So superior articular facets. And it's that smooth hand that's being held up by the arm. The arm behind it is the process. Superior articular process holds up the flat hand, superior articular facet. So I'm using the superiors to attach to the inferior. So as I flip it, these superior articular facets now appear flat on this side because this is the inferior articular facet. And what holds it up is the arm, the inferior articular process. So I'm using my processes and my facets to come together. And they come together at those facets. So on top, I'm using inferior articular facets to connect to my superior articular facets. The other unique thing about a thoracic vertebrae, as I describe these, is we're connecting ribs. So on my ribs, I'm going to use my vertebral end of my ribs to connect to these little projections here, here, and here. This is superior costal facet. This is inferior costal facet. And then on the transverse process, that divot is transverse costal facet. So I can flip it on the other side too. The depression on the transverse process, transverse costal facet, inferior costal facet, and superior costal facet. Those are only unique to a thoracic vertebrae, versus all the other bones have those other structures or bony markings that we learn. So transverse process, spinous process, superior articular facet. Behind it is the superior articular process, vertebral, foramen, and body. So we can describe all the same for all three. When we look at how we describe our cervical vertebrae, what's unique to them is the first two and number 7. So now I'm going to show you 1, 2, and then we're going to get all the way down to 7, C7, because I have 7 cervical vertebrae, 12 thoracic, and 5 lumbar. This flattest one here, these are all cervical vertebrae, and how do I know that? This flat one still has transverse foramina, but it also has the widest vertebral foramen out of all of them. And that's because it's C1, also known as the atlas. And this is the vertebrae that helps us to say yes. And so I'm using these articular facets to actually connect to the occipital condyles of the occipital bone. So I have atlas, which is my flattest bone, and we look at it, it's got those wide features to it, but it's flat, versus number 2, our C2 cervical vertebrae, is called the axis. So atlas and axis. Now remember, T becomes before X, so atlas helps me to say yes. Axis helps me to say no. Now what do I mean by that? Is that when I put the vertebrae on, we're going to use it to swivel, to be able to say no, I don't want to learn this stuff, or yes, I do enjoy learning this stuff. How do I know this is axis? A lot of students will say it looks like Buddha, and this is Buddha's head. And Buddha's head is called the dens, also known as the odontoid process. So dens or odontoid process. And this is how I identify what's unique for all of our cervical vertebrae as C2, the axis. And then lastly, we said our last vertebrae for cervical is C7. What's unique about C7, it starts to transform almost looking like thoracic, where I have that long, slender spinous process. But this spinous process is unique because we're going to attach a ligament here. We call this the vertebrae prominence. And this is going to attach one of our ligaments that goes to our occipital bone. So when we experience whiplash, it's impacting the cervical vertebrae. But we have more attachment points because we have a lot more movement in our cervical vertebrae. So that's a description of how we understand our different vertebrae. And then as we come down from lumbar, we're going to get to the sacrum. So our last vertebrae, our number 5 lumbar, is going to attach to my sacrum. And then after that, I'll attach the coccyx. So when we look at this, now we're describing how we have multiple landmarks for the sacrum and then the coccyx. So the sacrum is 5 bones that have fused together versus the coccyx or coccygeal bone can be 3 to 5. And typically we teach it as 4, but it varies on the person. In this case, we're seeing 4 bones. When we look at the sacrum, we're going to use this to attach as part of our pelvic girdle to the coxal bone. So as we describe it, I'll show you it still has that weight-bearing part of the centrum of the body. As they come down, we actually end up having some of our spinal nerve endings coming through what's called the sacral canal, and it'll go all the way down, and there's a hole here called the sacral hiatus. Because the spinal cord ends around lumbar 1, lumbar 2 vertebrae, and then it starts to expand in what we call the cauda equina, which means horse's tail. So when you look at a picture of it, you'll have all these nerve endings that are going down here to stay protected in a sacral canal, but then you'll end up with still a hole that ends up here called the sacral hiatus. Along the sides, you'll see more holes, and these are called sacral foramina. Remember, foramens are whole, plural is foramina, sacral foramina. And then down the middle, you'll see the median sacral crest, median sacral crest. And this is trying to show you all the spinous processes of those 5 bones that have fused together. So median sacral crest, our foramina, sacral foramina. And then on the sides, I have auricular surface. On the lateral sides, auricular surface. Auricular surface. And this is to attach the sacrum. So we have sacrum and coccyx.